what you like the most in dentistry?
The blood. Gosh, why?
Most of the clinicians, especially the big clinics, they are thinking that we are build a lab to reduce the cost.
There is a lot of clinicians, they dream about own lab until they will start doing it.
You know exactly what you are doing.
I am the guy like a general, yeah? So shut up and listen and go. So I want to do something new. I'm improving every day. If it's not happening, I feel I'm dying. Your life, your day should be divided in 3 parts. 8 hours the family time and enjoy 8 hours for rest. So I am not in balance. When you have someone and pick up the phone and say, hello.
How can I help you, sir?
Yeah.
I'll never come to this office.
At the end, success comes from the people who are inside. If these people would not like to stay with me so long, I would not be here.
Hello, everyone, and welcome to Charismatic Podcast. Today's guest is very special, Dr. Krzysztof Chmielewski.
Very good.
Really?
Very good. Almost perfect. So when you pronounce these Polish names or Eastern European names, it's quite difficult. So I understand, but you do really right. Thank you for this. Yes.
So we pronounce it like Chmielewski.
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 For foreigners, sometimes it's easier to say Chmielewski.
Yeah.
With K in front. So because it's. But you can get used to it.
But I'm really fascinated with the level of dentistry which you make. How you set your mind in this high quality thinking.
You know what? I think this is not something what you can learn. So you have to be HDAD or you have to be somehow focused or born with this tendency to get perfection. It's not something easy to follow because it is like a curse for all the people around you because you are not really happy with the results until you will reach that it's really something special. So I think it needs a lot of dedication and needs this kind of willingness to improve every next step. So I think every one of us has it. You are a business owner.
Yeah.
And the level of your business, what I see, the how you treat your customers with today's course and what kind of product you deliver, you are the same. So we are not so different. So I could ask you exactly the same, how you reach this.
Yeah, exactly. But I mean, do you feel yourself like you already reached the level which you are aiming for?
To the certain level, yes. And in my team, I have my senior prosthodontist, who is my business partner as well in the clinic. And, you know, sometimes we enjoy these moments where we reached the level of the mastery in this kind of in this treatment that we enjoy complex casing, all this brainstorming, where you have the partner on this level that you don't have to explain basic things. So, and we are just in very good level with prosto, with implantology, but I still see a lot of new things which come. So especially digital work, digital workflows, you know it better than me, how it is in the lab. We see it as well in our daily life, in the clinical work. So I am very excited with new things are coming. So I'm not sitting, okay, I know everything. No, there is so many things I want to learn. Every year I am going to many courses. I want to learn from the best people in the world because it brings me that I have energy and passion to do it next day. Yeah? So I think this is very important to have this passion, but as well philosophy just to keep rolling. Yeah, that next day I want to do better than today. Yeah?
But you did something very special, and I know it's very hard, but I don't know in Europe how you make it. Like every clinic or every big clinic or medium-sized clinic, they're dreaming to have a good lab or good in-house lab. And most of them, they failed by this. But you succeeded. From the cases which I saw you making, you have a very high level of dentistry and the lab support, which you have in-house lab.
Yes.
And I really admire you.
Yeah.
But in Europe, how you make it? Everyone is struggling to open a lab in Europe.
You know, this is very important that there is a lot of clinicians they dream about own lab until they will start doing it, because then they realize that it's completely different to run the clinic. It's completely different from the business point of view to run the laboratory. So for the long term, it is like a struggle to find yourself, how to manage dental technicians, how to manage the workflow. It is not like this that you will hire people or find people and they will do the job like a regular lab, because in most of the cases, lab owner is dental technician, specialist. He knows all the tricks, he knows how to control, how to manage. So I was from one side lucky, but as well it is once again dedication and to be consequent. So I have my own lab right now like 8 years. I had a hard time a few years ago when
Obviously.
I was wondering, gosh, why should I continue or not? But at the end, success comes from the people who are inside. It's rewarding when you see this restoration, when we deliver it to the patient, when I can share this quality of work, not only with patients, but with courses, with photographs I can share with you, I can share with other clinicians. So it is full respect to my team, and people who are inside, they are very special. Starting from the people who are making plaster models, going to the top ceramists who are the superstars. So all of the members, I should say individually, I should thank you individually to every one of them, because they make this beauty at the end. But I remember when I started with the lab, twice a week, every Monday or every Friday, we were making like separate meetings with all my team from the lab, and I was giving them lectures. We were discussing the cases. Later on, I was asking them that they should give a lecture for the rest, because this is the best. If you want to teach someone, you have to understand it first. So it is like a process. So I was lucky, but it is a long journey.
It's a long journey, and it's very difficult to manage, and it's very costly.
Yes.
I know you built this in-house lab, which is delivering to you very good product, or very good, like you have harmony.
Yes.
From business perspective, is it worth it? Like, is it really, because most of the clinicians, especially the big clinics, they are thinking that we are build a lab to reduce the cost. But I don't think that this is the case.
But I will tell you exactly the same what I said today during the course. If I would have such a strong business partner in the meaning of the quality of what you are delivering here, I would think twice before opening my own lab. If I would know the cost, the price which I had to pay to open it, I'm not sure if I would do this thing one more time, because I spent millions to establish it, to run it. And of course, I enjoy the quality. I am the freak in the controlling. I want to have the highest quality no matter the price. So from the business perspective, it's not a wise decision. Absolutely. But, just I was missing this kind of support which you have the same freak on the other hand side, on the other side of the battle. I mean, dental technician who is as well so dedicated with the new technologies, with new things, with the design. So it's very hard to make this combination. So you are providing this service here. And in Poland at the time, I didn't have it like this. So I was working in the past with few laboratories in Europe as well, from Germany, from Austria. So I had to compensate it in different way, but I wanted to have it in-house.
Yeah. Yeah, it's very difficult. It's very tough, but you did a great job. What you like the most in dentistry? Because obviously you like dentistry.
Yes.
Obviously, from the result which we see this couple of days, there is a lot of ambition. And what you like the most in dentistry?
The blood. No, but when I graduated, I have love and passion in many things, but my favorite is surgery and prosto. When I graduated, during the studies, I was working as a dental technician. When I graduated, I wanted to stay in the prosto department at the university. So for the short time, I was there. But later on, I realized that my passion is as well implantology. So I started slowly on the beginning, because I started with implants in 1996.
But you started with the pros first?
Yes. It was funny. When I graduated, I was at the university in the prosto department, and we had the implantology. It was just the beginning, and I remember there was one professor coming from Germany with the lecture at the university, and it was closed meeting only for let's say professors and assistants. And this professor was giving lecture, and after this I said, with implants maybe I will do the prosto, but never surgery. 3 years later, I was placing my first implant. So never say no. And my passion is surgery and prosto, but as well the digital workflows.
Yeah, but you don't hate prosto, of course. You don't hate prosto, the prosto part, because some of the people, they just quit. But you not quit. You just make it as an additional skill to your practice.
Yes.
Then you add the digital dentistry, which you are one of the best I saw in the world with the digital dentistry. You understand it very well. You know how to manipulate the softwares, to integrate them, and integrate them with the handmade. Like similar what I'm making in the lab. But you know exactly what you are doing. How you follow the digital dentistry? How you is it like passionate after the implant?
Yeah, I think this is like a combination of very small or tiny things which you do in your life. I remember my wife on the beginning, because I'm freak in the photography and in video making, graphic design. So I was spending a lot of time when I was just a young dentist, trying to learn new things. Working with Photoshop, Lightroom, some other softwares, just to play and manipulate. So you gain some skills here. Then you see another software which helps you to understand other things.
During practicing the dentistry?
During practicing dentistry, yes.
Where do you get the time from?
This is once again, one will play with the smartphone or watching TV. Another one will spend some time, additional time, just to learn new things. I like to learn new things. This what drives me, what gives me this passion that I want to do something new. Because the worst case scenario is that you know everything, it's stable, it's not my lifestyle. I want to do something new. I want to just feel that it's rolling, that it's something new, that I'm improving every day. If it's not happening, I feel I'm dying.
You know, only humble people can learn, because however anyone say, I don't want to learn, that's meaning that they block the receptor of learning because of the ego. But obviously, when you want to learn more, you have to feel humble first, that no one knows everything. Even with the knowledge which we know, we still need to know.
I think this what you are saying is needs additional comment, because the profession which we are doing, clinical, being a doctor, being a good dental technician, provider of the health quality service, it is a must to have this continuous education. Because, as I said today, the highest risk for the patient is a dentist. From my knowledge will depend, from your knowledge will depend materials, technology, the quality, the treatment quality, and what patient would benefit with this. So it's really very high responsibility. My parents raised me in a way to have respect no matter whom you are. To earn respect, it is not by title. It's not with money. These are other things which gives you respect. And treating people with the same respect how you would like to be treated is very important. So I try to deliver to my patients the best what I would expect from myself. When I was creating lab, I was trying to create environment which I would like to work. Mm-hmm. So I give the best to them. I give the best to my patients. So from the business point of view, not always it is the best choice, but I enjoy what I do. It's really great.
How you let the people to follow your passion?
It's not easy sometimes, because I can be tough. I can be rude sometimes, but of course this is a culture in the clinic, in the company. I was not all my life the same. I see with time how I am changing as a person, when I compare when I was 20, 30, 40, 50. I see the big difference. So I have more, let's say, compassion. I have as well more understanding in different personalities. But from the color perspective, I am red. I am the guy like a general. Yeah? So you follow my orders or we have the problem. Yeah? So you have to learn as well how to deal, how to control myself. I remember one of the radio audition, and there was a great guy, one of the top billionaires. He got a question, what is the most difficult part in his life, in the business and in the relation? What was it? And he said one thing, the most difficult part is, as a head of the organization, big or small, to come every day, to wake up every day, come to the office and give the positive energy to the others. Your mood and energy is not important, because if you come and people see that you are angry or you are with the bad mood, immediately everyone will be. So I have it still always in the back of my head. If I come and behave in the wrong way, immediately I have it like an alarm in my head. Come on. These people, they have no idea what you have, that somebody is just maybe asshole on the road.
Yeah.
Or you had some other issues. So it shouldn't be affecting your organization. So I think this is very important from the head of the organization, from your behavior at home, in the office, in every place, what you get back, yeah? and how it is. The people and their reaction it is the mirror of you. Yeah.
Yeah, there are two types of people, taker and giver.
Yeah.
Where do you classify yourself?
I take and I give.
How?
Different proportions. So, for instance, from one side, I take a lot from others in a professional way, in a meaning of knowledge, clinical stuff, etc. But in the same time, I give it back to others. I give it back to patients and I share with other doctors, other colleagues. So this is taking and giving. In a private life as well, you take some energy from your surrounding, from people around you, but you have to give it back as well if you want to be all the time surrounded with the positive. And of course, this is great just to have only positive people around you. And the worst thing is that suddenly when you have your good mood, but somebody is not in the good mood, and suddenly all your mood and organization is starting to be infected. So there is a lot of things which can be changed because of good or bad behaviors of people. Yeah? So I don't know how it's about you.
Taker or giver?
Yeah.
I believe I'm more giver than taker.
Okay.
And I start enjoying it because I enjoy to take.
Yeah.
But really, I enjoy more to give.
Yeah, it's. I think this is a wisdom which is, of course, very important. Just by sharing and giving away, you enjoy more. Yeah. So everything depends on the level, what we are sharing. But it can be different ways of giving, supporting others and giving. You can give knowledge, energy, money, improve someone's life. So there is a lot of things. But I think this is, in your case, it's a lot of positive, because when I see the size of your organization and structure and how you treat and see your behavior with people, with your team, you did a really good job.
Yeah, for me, it's not a job.
So
it's not a job. I don't consider myself. I always tell them I did not work any day in my life. It's just my passion. I go to work because I want to go to the work.
Yeah.
But usually, the most thing I enjoy is to helping people.
Super.
Because I feel how they will be happy, then I will be happy.
Mm-hmm.
But always taking then.
Yeah, it has to be balanced. How many hours do you work a day?
In average, maybe 7, 8 hours. But previously I was working like a donkey. I was working 16 hours a day.
So I'm still donkey.
No, sorry for
No,
that.
no. But it's true. It's true. I asked you by purpose because one of the trips which I had with the family, we met very wise guy in Asia, and we were talking about the life and everything. And he said it's very simple. Your life, your day should be divided in 3 parts: 8 hours, 8 hours, 8 hours. 8 hours work, 8 hours the family time, and enjoy 8 hours for rest. So I am not in balance.
The problem becoming is even the family time, sometimes it's not rest. You have to do also something because after you finish the work, you have to get back. Then also people, they need you. They need something from you. Then you have also to give. That's why I don't know if we're forced to be givers, but we enjoy it. We have to enjoy it anyway. But you're still working too much hours?
I work a lot because...
How many hours?
At least 12.
12? 12 hours?
12 hours a day.
What time you start?
My time is divided, so 3 times a week. I am just early in the morning, 6 o'clock in the training, in the workout. So I'm in CrossFit. So just to have to keep a little bit of physical fitness, energy. And then I am going to the office. So I start after 8 a.m. and I leave quite often after 10 p.m.
So all your work is with the patients? With
the patients, but as well with the team. In general, my focus is mostly on the clinical part. I'm medical director of the setup. And what is happening as well, that in the meantime, I am just as well involved in many projects related to the education. Of course, these are lectures, these are photographs, reading, writing, books, articles. So there is a lot of work behind. So in the same time, we have the team of the clinicians. So planning, just correcting everything or trying just to have everything done on time, laboratory. So you have as well different setups. So it needs your attention at a certain point.
So you do 4 things usually: patients, you do managing the staff, managing the lab, and you do some articles and this scientific part. Yes. What is the percentage of the work here or there? Because 12 hours.
Clinical work, it's like 75 to 80%.
With the patients?
Yes. Because the setup of the team I have, that's HR or just relation with the team. We have the separate people managing this. I am just involved in some, let's say, important decisions. So we are trying to outsource. My daughter, she's my partner in crime. So she's helping me a lot. And
what is she doing?
Maya, she is a surgeon in the team, a junior surgeon. Yes, so she is doing all the implant cases with the single basic bone regeneration, digital workflows, all on 4. So I am doing the most advanced cases in the team. Yeah.
How you treat her in the clinic, as a daughter or as a dentist?
Oh, the beginning was difficult. It was a clash, really, because she came from the US and she joined the team. It was our dream for her and for myself. And suddenly it was like different scenarios. Me as a general, do as I said, and she is researcher in mind. So she was not questioning, but asking a lot of questions. Why this, not this? Why this, not this? She wanted to understand.
Over your shoulder.
Over
while
my
you
shoulder.
Are doing the work.
Yeah, for instance. Or it was just before we start. She had a long list of questions, and at a certain moment you have to shut up and listen and go. So later on I will explain. So it was like a different personalities. So we both needed time, and my close friend Oliver just helped us a lot just to find the...
Who's Oliver?
Yes.
Who's
He is one of my best friends, and
He's working in the clinic as well.
No. He's not related. He's not doctor. He is very ambitious and very successful businessman, and he helped us to understand the differences in between us. So
how he helped you?
it was like a judge in between of us, a little bit, like a, negotiator, just to show us that we have the same, let's say, direction, but we have the different visions for some of the things. And what is sometimes missing, that we don't have the right communication, in a meaning without emotions and with open mind to understand the differences. Because especially when you have this family relation, you think that you know and understand that somebody should understand what is even unspoken. Yeah. So it is like with the regular woman. Woman remembers the things what it didn't happen even. Yeah. so these are the difference. But I'm very happy and lucky that she is next to me and I can rely on her. She is a great doctor, and her patients love her. So recently I had this funny story that a patient in the waiting room was supposed to be in Maya's office, and she had some delay, and I want to take her into my room for the consultation, and she said, no, doctor, I prefer Maya. And I said, okay. What? I'm your doctor. No, I prefer Maya.
I told her.
I said, and it is a great moment when you see that your team or people they have the same attitude, the same similar targets, because especially to become a good doctor, doesn't matter your specialty, is to be in good relation with your patients. So to understand them, so to see what are their needs. So of course, if you don't like people, it will or it will drain your energy, so you can feel exhausted. We are in the service, medical service, which requires additional energy, not only to communicate with your team, but with the patient, who is the number one.
Which is the most difficult part. The psychological part.
Yes, and these are the things which you can learn to the certain point, but this kind of sensitivity to the atmosphere or what is non-verbal communication, it makes the differentiation why some of the people are more or less successful in relationship. So I think especially medical services, dentistry is very difficult for doctors, for the clinicians, because after the work, they feel drained, and sometimes you have no energy to come with the positive energy back home, because you treat your patients and you always have to be smiling. You have to be with the positive, even if it is difficult.
You cannot separate that?
It can be difficult, because if you work many hours with different people during the day, and you have to give this energy, this is what at the end is missing. When you are coming back home, you don't want that anybody will take you out of your comfort. This is when I'm coming back home. It's funny, because my wife, she's a doctor, so when we meet at home, there is always like a sequence of the questions. When my wife asks me how was at work, and I answer good, don't ask any more questions. This is my let's say under the surface, good, it's okay. And then I have to ask how was at your work, and then she starts to speak, and then I don't interrupt her for 1 hour.
Oh, that's good.
so I shut up and listen. And and this is the way how we communicate. We are long enough, more than 30 years as a couple. So it is like, a best friend. So you know each other, you know your behaviors, you know that you can count on each other, and this is my castle at home. When I am coming, I won't leave behind the door, let's say, problems from the outside. Yeah, I want to just have this comfort zone at home. So it gives me this kind of relaxation.
What is the most difficult part in your job? The most difficult part that you really dream that this part is just will disappear?
In the meaning of the procedures, or in the meaning of the running the clinic?
During these 12 hours.
The most difficult part comes when suddenly out of the schedule which you have some episodes or some changes in the, let's say, plant structure. So it comes that you have additional, let's say, patients with some trauma or with some problems, or something is happening in the team where you can act, where you have to act immediately. So it is coming you out of is bringing you out of the plan where you divide it. This is how I act when I start my day. I have like one of the office work, which I get from my manager, like a list of the tasks which I am supposed to do. So this is my way that what I do, I mark. So I want to see that it disappears. And other hand side is the work directly with your patients. So if something is going out of the structure of the scan, it brings this kind of stress. So the thing which I don't like, when we have any delays, when patient needs to wait. So the longer patient waits, like 5, 10 minutes, 15 minutes, because you have some procedures which was like emergency whatsoever, it brings this kind of stress.
Stressful.
Yeah, because you have to be focused on the one side with the patient which is in the treatment room, but in the same time you have to think what is happening around, because when you are maybe employee, it is less important for you, but as a business owner and you work about reputation, and you have important people who respect the time because they are in time in your clinic, and you deliver delay. This is which we don't like, which makes me stressful.
But how often this will happen? Because it's very difficult to manage the time, because during the procedure is something getting wrong, out of the control, then you have to delay. But how often you let the patient wait? I know this is not your aim, just to put them at the same minute, on time, on the chair. But
in my case, it's happening not so often, just once, twice a week. So it is not like everyday routine. So we changed it in a way that I have, let's say, the list of patients which I have enough time for them. So I can finish the procedure. I can, let's say, if I have any small delay, I can compensate it with the next patient, because I will speed up with some procedures. So this is my comfort zone, which I like. That's why if something is happening extra, which creates like a, dense graphic, dense schedule, then it starts to bring this kind of energy on a different level, that you start to feel stressed. So it's not only procedure, but as well the keeping everything on time. But
now you answer my first question, which I told you, how do you deliver the quality? And this is part of the quality, because many clinicians, and I know them, that this is not part of their thinking, that they don't think that the patient should be on time on the chair.
Yeah.
They have to excuse you because you are with another patient. This is the answer of the first question, that the mindset. So the mindset is different. So when you have this mindset, you respect the patient's time, that they came on time. You have to put them on the chair on time, because they have another appointment with another person. They have to be on time.
But this is one of the basic points. And actually, a lot of people, especially when you run premium or deliver premium services, you have people who are used to 5-star hotel. They are driving luxury cars. They are going for great holidays, and they know what means best and good and bad service. So they can be polite to you, and you will say, "I'm sorry for the delay." And some of them, I understand. But 5 minutes waiting after your scheduled time in the reception or in the waiting room, they look gently into your watch. So my reception immediately knows we are just on the edge.
You must have a smart receptionist.
Yeah. Because it's receptionist is a front desk. This is your signature. So from the ladies in the reception, we really expect a lot, because this is the first call. This is the communication. How you if you like the people, and I hear immediately it is when you call to the company, whatever it is, when you have someone and pick up the phone and say hello and smiling when he's asking hello, how can I help you? Immediately you can see, without seeing this person, that there is positive energy, that somebody wants to help you to solve your problem. But when you hear hello,
how can I help you, sir?
yeah.
I'll never come to this office.
So these are the things. So we learned over the years that we are very good from the quality of the service in a meaning of the treatment what we provide. So it is top class, top world treatment.
From start to end, you cannot be weak in any part. It's like one joint is not working.
Yes. If we are missing, it means it needs some additional training, some development, maybe new people, maybe new things to add. But the thing is that patients cannot recognize what is under the umbrella, because patient cannot judge the quality of your treatment. This is the issue. That's why sometimes patients think, what is the difference? Because this costs the half price, so I will maybe choose this one. What patient can really differentiate and see is the quality of the service in a meaning how you care about them. So the patient is on time, you have the nice coffee, you have the clean environment, you have great reception, there is a call, how are you after the next day after the surgery, or a reminder, text message or the phone call, Miss Smith, come, next day you have an appointment, can I help you, or there is anything on the way which is bothering you. So there is a lot of stuff. So we want to deliver premium quality of the treatment, but as well the top service in the meaning of the service provider. Yeah.
I know a lot of clinics, they don't pay attention to especially the receptionist, which I consider it one of the most important person after the technician. Most important, because I know for a fact some of my friends, they had the receptionist, and this receptionist, they don't feel nothing. Patients are coming, going without any problem. Then this receptionist asked for increment. They did not increase her. She left to another clinic. They hired another person, and the revenue started declining. So what's the reason? They look at the reason, then they discovered that the previous one, she has very high emotional intelligence. They can interact immediately, breaking the ice with the patients, because the patient at the end of the day, they don't like to go to the dental clinic. Yeah. So if they see anything not in the proper way, they will use it as an excuse that they will reschedule or they will never come. So this person is very important. Yes. And I know many of the clinics, especially if the clinic owner is not a dentist, they don't know. They feel like we just hire some beautiful woman in the reception and that's it. No, this person, they have to have very high emotional intelligence, how to deal with different type of patients, different backgrounds, different level of living.
And I agree 100%, but there is one more challenge, especially when the organization is growing. You have growing number of people. So for instance, we have right now six receptionists in our team, and we will add most probably 2 more. But in the same time, how to manage with the growing organization the same quality of the service. It needs a lot of training as well, and this is what we are trying all the time improve.
But I think hiring from the beginning to choose the right person.
This is very important, and in the hiring process, ladies who are in the reception, they have they can influence if this person which is on the trial period will fit to the team. So we are having 2, let's say, levels of judgment or evaluation of such a person, because one is the skills which you have in your CV, the second, interaction with the team. So immediately this is one of the key elements, because ladies exactly feel if this is good energy or it is not good energy, because you want to have that ladies at the end.
Who
the
has this
reception.
evaluation? Who make this?
Initial evaluation is done by the head of the receptionist. So she is responsible for the initial evaluation of the CVs, and in the final stage they select like 2-3 candidates, and then the last step is done by us as a company owners.
But the second level,
Second level is done by manager as
the
well.
managers.
Yeah.
You have to feel like this person is fitting the blood of the
Yes.
company.
Yeah, this is one of the stories, and we always have this kind of trial period where we just say it in an open way. This is the time that you can check if you fit to us, but as well we can check if you fit to us. So this is both ways. It should be fair, because as well the energy or culture of the company sometimes is not your way, how you see yourself. And as well, we want to see if this person, what is the future plan, because you don't want to invest your time in training if you have the person who maybe next year I will, I don't know, move to US. You know, so it's wasting of your time.
Yeah.
So it's not easy in Poland where I live to have very good team in the lab, but as well in the reception, good assistance. It's a long process. It's a long process just to find the right people. I am in the age where some of my assistants were working with me 30 years. So 2 of them are already, actually 3 of them are retired. 1 left with the retirement.
30 years.
30
Is there
years.
any person now they can work in the same company 30 years?
Yes.
This is
Yeah.
a miracle, man.
Yeah, I have 3 of them, and so right now the only one will stay still, and she is the head of the nurses. Her knowledge about the procedures or everything is unbelievable. So she is as well responsible for the training of the team, but as well managing the assistants and the nurses. So. I think this is critical that we have reliable people in the team, because my success is the result of the people who are around me. You know? So it's not only my work and my dedication. If these people would not like to stay with me so long, I would not be here.
How many clinicians do you have?
We have right now 8.
8 clinicians.
Yes.
Dental chair, how many?
This right now we have 8, and we are adding additional 3, 4, 5, 6, 14.
Can you hire me?
I cannot afford. You are too expensive.
How you know? You never know. But your clinic is in Warsaw?
No, in Gdańsk. So it is north part of Poland.
North part.
Yes.
So is it not cold there?
Not really. This is on the Baltic Sea, and Gdańsk is very beautiful city with more than 1,000 years of history.
Uh-huh.
Beautiful architecture, beautiful setup, open people. So whenever you are in Poland, whenever you will come, please visit me in Gdańsk. But this is
My pleasure.
very nice place. Very nice place to live.
Is it traffic there, or it's a big city?
Not like here in Dubai.
Yeah, of course, nothing like the way in traffic, especially in the rush hour. But is it big city or?
So Gdańsk is like a combination of because 3 cities are connected with the borders, so it is like one big organism. So it is like Gdańsk is almost 450,000, but with all the cities around and satellites, is the population like around 1 million. So it is compared to this location is, let's say, small, but still with good quality of life. Good patients, but as well, like everywhere, competition. You know? So I like competition, honestly. I like this drive where you see that your colleagues or customers are doing something which maybe we should improve. So it is moving you forward. So this kind of competition in business is very good. You know? Some of the people don't like it because it brings the stress or you feel angry. But after a while, you realize that it brings you or it pushes you just to the next level. Because normally you would not do it because you are in the comfort zone, you feel everything is good, everything is perfect, but suddenly something has to be changed. Yeah?
True, yeah. You have to have some motivation. And the best thing is the inner motivation, but sometimes your inner motivation will be a little bit lazy, so you look at the competitor. But I believe for me, this is personal. Like, I believe the most important competitor is myself. So always I compete myself. I really wish all the best for everyone. But we think about it like, I compete myself. We have to be better than what we are yesterday.
Yes.
Only during the hour, but during the rest, we just want to get rest. No, if you are not a dentist, what would you be or what you wish to be?
If I'm sure that if I would not be a dentist, I would be a professional photographer, cinematographer, maybe graphic designer, because I love to create. I like to some of the books which we published. I designed them from the scratch, everything. I really love the process of creation. So wherever I am with different, I am sure that if next day I would stop doing what I am doing, I would find in a short time another passion, which would drive me to the excellence, because this is what is my construction. When I start to do something, I want to do it 100%, or I do nothing with this, and I abandon it. So this makes me happy, brings me this kind of drive and passion that I can reach the excellence in something. Yeah? So I think, photographer, video maker, cinematographer, it would be the space.
I will never be videographer or photographer.
Why?
Because I have good videography.
But in your case, what would be your passion? If
never
not dental
thought about it.
technician.
If not dental technician, I believe, since I like to helping people, then I like to lead them to the best direction.
Okay.
Then I would be like some entrepreneur in some another area. Yeah, maybe. But I like to have big team, not because of my ego. I don't care like if somebody tell me you have big team or small team, but I like to really help the people, because leading them is helping them. Because most of the people, they don't really set goal. They don't know what's good or bad for them. So to help them, to let them see what's good or bad for them, and pushing them to this this direction. So maybe entrepreneur in something else. Maybe I like to travel, but after 5-6 travel, I feel like I don't like to travel anymore.
Okay.
Again, the circle. It's happening again, but I believe you travel a lot because you're lecturing for a lot of countries, right?
Yes.
I really admire you. You just landed here at 2 a.m.
Yeah.
Then next day, you have to wake up 6 a.m. And I saw you how you lecturing with all of this quality, and you were really focused. You were really like fresh. I don't know where you get the freshness if you did not sleep enough. How many hours you sleep a day?
I try to manage the quality of the sleep. Right now, during this travel, I was sleeping like 4 hours.
What?
Every day. Yeah.
This is the quality of the sleep?
No, this is not quality, but when I'm traveling, sometimes it's difficult for me just to get the quality of the rest. So, but when I am at home, I'm trying to keep the minimum like 6 hours, but 6, 7.5, it is something what is fits to my, let's say, time which I need. But of course, I should improve this part of my let's say, hygiene of the lifestyle. But yes, I travel a lot. So every week almost I'm off the office during the weekends, going with lectures or going to learn something to be better next day. But you can get used to it. I am excited every time when I travel somewhere. So it is it's nice. Yeah.
Best country you traveled to?
You know what? This is like a question because my family, we are diverse. Yeah. When I get the question from people, which place is the best for diving.
Okay.
And then you start. It depends. So the same is with the cities, and the same is with the countries. I love Australia. I love some remote locations, and I love nature. So I am less in the cities, more in the nature. So that's why we love traveling in the very remote places like Papua New Guinea, like New Zealand, like Pacific Islands, but in the same time Alaska, sometime in some remote location when you have wild animals around.
Now you go from the east to
North,
west.
south, all the directions. So we always, when we plan our expeditions and the places to travel, we want to experience something new. Of course, there are places where we are coming back, but I know that the life is too short to visit two places, the same place twice. So yeah, I love. There are some countries which you like more or less. I like very much Asia. Very much. Like in the same time some areas of US. So
You
I
like
think
diving, yeah, I understand.
every country, each country has something special.
So the best cuisine?
I love Thai food.
Thai food. You like
Yes.
spicy?
Yes, but let's say with the European spiciness, not this way.
Yeah, this is one very important because I asked one Pakistani friend, I said, this food is spicy.
Yeah,
He said, no, it's just mild.
mild.
But for him, it was mild. For me, every time I have to look at the wall, what's going on.
Yeah, but I like this also Japanese food.
Mm-hmm.
I love it. I love, of course, Italian food.
Mm-hmm.
So Indian food, I like the spiciness. So my son-in-law, he is from Nepal. So we have this spicy food on a daily basis. So it's nice just to have different experiences with the cultures. But what about your favorite food cuisine?
I like all type of foods, all cuisines. Usually Mediterranean food.
Okay.
Mediterranean food. All Mediterranean food. All countries, you name them.
Yeah, Turkey,
Spanish,
Greece,
Turkey,
Yeah.
Greece,
Super.
Syrian,
Lebanese.
Lebanese,
Yeah.
Moroccan, Algerian, all of these countries, they are making because the vegetables there is really special. And
Yes.
yeah, I like this type of food usually, but also I like seafood a lot. I like everything. I eat everything.
Yeah,
Everything,
but-
especially when I'm hungry.
Yeah, it's very hard to find person who does not like Italian food. Yeah.
Of course, yeah.
But yes, we share the same actually. That if the food is good and with some heart and dedication, you can really enjoy it. Yeah.
True. Thank you very much, Dr. Chris. It was a pleasure to have you here in Dubai, and pleasure to have you here in the podcast. It was amazing, and wish to see you again.
It was a pleasure for me. Thank you for the invitation, and it was really great experience. I'm not the first time in Dubai, but whenever I'm coming here, I enjoy what I see. So it's very special place, and it was really a great experience for me to be with you today and last days with all the clinicians around.
Thank you very much. Thank you.
Thank you.
Thank you, and looking forward to see you in the next episode.
Thank you
You're
very much.
amazing, man.
It was nice talk, nice discussion.
Very nice. You know, people are missing this. They want to look at the other part of dentists, not only technical. And
No.
technical is easy.
Yeah.
But the lifestyle, how to manage your lifestyle.
Yeah, but in the same time, what is happening that people think that your success is just given by the God.